In this video, our team will explain how we developed a robust method to support communities with identifying local maternal and child health needs. We will share the motivation behind this body of work, the goals that we outlined, and the processes used. We hope this video will give viewers a deeper understanding of the utility of this tool known as the Family Support Needs Assessment and how it can support communities and serve as a reliable and user-friendly resource to local leaders across many sectors. Our ultimate goal for this body of work is to have an impact on improving the health of women and children while addressing social and environmental factors influencing the well-being of families. The Maternal, Infant, and Early Childhood Home Visiting Program, otherwise known as MCV, was enacted by Congress in 2010 to support the expansion of evidence-based home visiting services for pregnant women and parents with children up to kindergarten entry. Evidence-based home visiting services are voluntary and offer in-home support focused on parenting, healthy child development, and family well-being. MCV provides direct funding to communities for delivering services and allows them to tailor those services to meet the specific needs of mothers, infants, and children. For states to continue to receive these federal funds, they must submit a statewide needs assessment every 4 years. That's why the Department of Human Services, Office of Child Development and Early Learning asked our team to collaborate with them to develop the 2020 Pennsylvania Family Support Needs Assessment.
We had some specific goals in mind when we were working out how to make existing maternal and child health data more meaningful and useful to various stakeholders. And our ultimate goal was to create an index for several content areas that are central to how people think about maternal, child, and community health. And when I say index, what I mean is essentially a list of scores related to various factors, things like the rate of preterm birth or maternal depression. And when you take all those things together, they summarize a community's strengths and needs into one score so that it can be compared to other domains within the same community or compared to the scores of other communities. Much of these data were already out there, publicly available, just dispersed across numerous data sets and databases. So the simple act of pulling them all together, standardizing them to our population of interest, and organizing them into our 6 domains, which we'll talk about in a minute, was intended to make this information more accessible to folks doing work to support families with young children across multiple sectors. And the next thing that we focused on was intentionally including indicators related to social and environmental factors. Things like how much of a person's income go to pay their rent, or the number of libraries or parks in someone's area. These factors have a big role in shaping individual experiences and also a community's access to resources. So while many maternal child health assessments will look at traditional health outcomes, we really felt like combining these two kinds of indicators provided a more complete picture of the needs and opportunities in each of Pennsylvania's counties.
Together with the state, we wanted to create a comprehensive and systematic way to understand the needs of local communities across Pennsylvania. So we came up with a way to illustrate not only each county's need on a specific data point, like preterm birth or maternal smoking rate, but also a summary assessment of how they compare to the state average on a particular topic. We called these domains in our report. This gives communities a better sense of their own strengths and needs as compared to the rest of the state. We calculated 6 overall domains from a total of 66 indicators. As mentioned before, most of this data existed publicly, but in some cases, when public data weren't available, we used administrative data like birth certificate records or medical billing claims to create our own data points. Our approach allows community stakeholders to engage with the data at multiple levels. First, they can see their level of need compared to the state on each data point. For example, if someone wants to know the poverty rate in their county, they can find the raw numbers and they can see if that number falls within the top middle or bottom quarter of all counties. Second, we've also provided a way to look at risk within each domain. So if they're interested in socioeconomic status more broadly and want to see a more holistic view of how the county is doing, rather than just seeing the poverty rate, there's an aggregate score that sums up all of the indicators within the socioeconomic status domain.
We kept in mind that our readers may have different goals and interests when using our report, and that's why we presented the results in multiple ways to better serve readers with different roles or who work in different regions. So if you're interested in any particular indicator or domain, you can view the specific results for that. The table here, as an example, is focusing on the indicator of neonatal abstinence syndrome. It shows which counties in Pennsylvania are at elevated needs on this indicator. And on the other hand, you can also choose to view the results focusing on the county you live on or work in. We created profiles for each of the 67 counties in Pennsylvania. Just to show you an example, here you see the profile for Blair County. The profile summarizes a county's need across 6 domains in symbols like traffic lights. Elevated needs in red, moderated needs in yellow, and low need in green. We also have some language there to highlight each county's unique strength and areas for improvement based on their need indices. And if you like to view the results for the Commonwealth as a whole, you may also find the statewide maps useful. Here you see the map for the childcare domain, and with this map, we are able to explore how childcare services may vary among regions within the state.
The findings from this work showcase the unique strengths and needs that exist in Pennsylvania's counties and highlight the incredible amount of variation across the state. We found that some counties had nearly universal rates of breastfeeding at hospital discharge, while other counties saw only half of babies breastfed at hospital discharge. Access to health care varies as well. For example, while primary care physicians were generally available, 37 counties had no pediatric dentists, and access to community health centers varied widely as well, which is an important resource for underinsured or uninsured families. When we look at the combined scores of need across the 6 domains, we see both clear strengths and opportunities to improve measures of health and access to social services. Positively, 1/3 of Pennsylvania's 67 counties did not score elevated need in any of the 6 domains. But conversely, 15 counties met elevated need in 3 or more domains, indicating that these counties have concentrations of risk that may require focused attention of support services. There were few geographic patterns of concentrated need, which emphasize how important it is to understand each county's local landscape in order to drive meaningful change.
We believe this index will be useful to a wide variety of stakeholders, including community planners, local governments, policymakers, and advocates, as they plan for tailored, programmatic, and policy responses to address maternal and child health. The index includes several features, like county indicator tables, to assist in identifying community needs in relation to other counties across the Commonwealth. We also included publicly available raw data summaries of all data used so communities have access to localized, ready-to-use maternal and child health metrics. We hope this readily available data and the index provides communities and service providers with information to assist in grant submissions, host community conversations, advocate for local cooperation, and develop thriving local partnerships to benefit children and families. Please check out the full Family Support Needs Assessment through the Pennsylvania Department of Human Services website. And please use this QR code if you'd like to read our research paper. It's open access and free to download.